Good evening, guys. Welcome to our daily learning platform. I hope so my voice is audible and screen is visible to everyone. Please confirm.
Yes, sir.
Okay. Thank you. So today we have the agenda to discuss cause of infertility in females and women. So around about our discussions will be going on that. And in the previous sessions, we have identified the different root causes of infertility. Okay. So I think everyone joined now. Okay. So in the identification of root cause of infertility, we discuss about the blockage of fallopian tubes, PCOD, endometriosis, immature egg formations, age factor, okay, thyroid stimulating hormone, pituitary gland, diabetes, uterus fibroids, lifestyle, genetic disorders. And apart from this, problem in the implantation of egg, quality of egg, bacterial infection, cervical pH, SNP mutations, ovarian cancer, uterus small is there, and cancer or recurrent abortions or irregular menstrual cycles. These are commonly reasons behind the infertility in the women. So the cause of infertility, common cause of anovulations and ovulatory dysfunction, guys. These are a common reason behind it. Okay? So one by one we will discuss today. Polycystic ovarian syndrome, the reason behind that, too low body weight, extreme exercise, extremely high level of stress, hyperprolactinemia, thyroid dysfunction, hypothyroidism, pre-menopause or low ovarian reserve, premature ovarian failure. So these are the common reason behind the cause of infertility. Ovulation disorders which affect the release of eggs from the ovaries. There is a polycystic ovary syndrome. Apart from hyperprolactinemia, a condition in which you have too much prolactin. The hormone that stimulates breast milk production also may interfere with the ovulation. And in case of a hyperthyroidism or hypothyroidism, okay, the level will be decline or increase, can affect the menstrual cycle or cause infertility. Other reasons behind too much exercise, eating disorders, or tumors may be the cause of infertility in women. Apart from this, uterine or cervical abnormalities, that is the non-cancerous benign cancer tumors are there in the uterine walls. Uterine fibroids are there, may cause infertility by blocking the fallopian tubes or stopping a fertilized egg from the implanting in the uterus. Abnormalities with the cervix, polyps in the uterus or shape of the uterus is there. So uterine malformation, guys, okay. Sometime uterine malformations, some type of there, atresia of the vagina, atresia of the cervix, just uterus bicornis, unicornis, rudimentary born, uterus didn't leaf files, face double vagina, uterus accuratus, and uterus bicornis. Some of the abnormalities are there, malformation of uterus is there. Uterine fibroids are there, cervical cancer is there. So such type of cancer sometimes is there. So they may cause they may become the cause of the infertility. So every part is very important in the reproductive system in case of female. Apart from this, we have discussed about the fallopian tube damage or blockage. Okay, the inflammation of the fallopian tube, that is the salpingitis problem, maybe sometime in the women are seen. That may be the cause of infertility. This can result from the pelvic inflammatory disease, which is usually caused by sexual transmitted infections. Okay, so sexual transmitted infections like STD disease are there. Okay, which organisms are involved in the STD disease, guys? Any volunteer want to give answer? Any
Sir,
idea about it? Yes.
gonorrhea, sir.
Nigeria,
AIDS.
Nigeria
Gonorrhea,
AIDS,
sir.
gonorrhea. Okay. Uh, which second?
Syphilis, syphilis, sir.
Syphilis also, guys. Okay. So syphilis may also become the problem. Okay. And HIV. Okay. HIV, human immunodeficiency virus is there. So HIV virus may cause also STD disease in the female reproductive system, guys. Okay. So when the woman going to attend the pregnancy, okay, they have to go for the all type of screening test, guys. HIV screening test should be there. The syphilis concern test should be there. And apart from this, you Nigeria gonorrhea concern test, go for that. Or apart from this, the number of tests are there. Any type of communicable, non-communicable problem is there or not there. Concern with. So physical health of the woman is very important when attending the pregnancy, guys. Okay. So as compared to the male guys. So because of that, for everything happen during the 9 month within the female. Okay. So that's why we're starting from the first day of the intercourse to up to the pregnancy at any time. So it's any type of the infections. Sometimes the infection infected men are infected with the STD problems. Okay, and they undergo the intercourse without any contraceptives or any other such type of preventive measurements. Or that may cause of sometimes syphilis problem. Or syphilis is a very common problem we are seeing that. Number of cases I've seen the syphilis problem, HIV problems are there. Especially in case of army people, guys. See? So they have such type of issues and problems. Okay, so a real live example we have seen concerned with the syphilis and HIV. So that's the reason behind that. Your single mistakes may cause hampering the entire life and your incoming baby also. Okay? So we have no such type of remedial or medications available nowadays which can cure 100% to such type of infections. Okay, only preventive measurements we have on that the pathway, and should be avoided such type of mistakes. And if some happen, this is you immediately go for the investigation, guys. Don't be delayed. Okay, don't be shy. Don't be hide anything that is concerned with your physical health. Okay, and such type of infections transmitting from one person to another person. Okay. Apart from this, we have the endometriosis problems or adhesions, that type of problems. Endometriosis, which occurs when endometrial tissues grow outside of the uterus, guys, and may affect the functions of the ovaries, uterus and fallopian tubes. So, in the picture showing blockage of tubes are there. Okay, such type of blockages are there. Okay, and endometriosis problems are there. This is the endometriosis problem. Okay, so that may cause the infertility in women. Apart from this, primary ovarian insufficiency, earlier menopause may be there. When the ovaries stop working and menstruation ends before the age of 40 years. Although the cause is often unknown, certain factors are associated with earlier menopause, including immune system disease, certain genetic conditions such as Turner syndrome or carrier of fragile X syndrome, and radiation or chemotherapy treatments. So sometimes in the women, they get the earlier menopause state before the 40 year. Okay, so before the 40 year, if they get the menopause or if they had no eggs, okay, for the fertilization or a few eggs are available. So such type problems are creating attending the pregnancy in the later years. That's why we are recommending should we attend the pregnancy before 30 years. So then the peak time is there. Okay? Otherwise, later in the years, it is difficult to attend the pregnancy. Okay? And pelvic adhesives, bands of scarce tissue that binds organs that can form after pelvic infections, appendicitis, endometriosis, and abdominal pelvic surgery. So that may also cause in the infertility behind the humans. Cause of infertility, that is a cancer, its treatment styles, okay, cancers, ovarian cancers may be there. And particularly reproductive cancers often impair female fertility. Both radiations and chemotherapies may also affect. Cancer diagnosis first of that, okay. So in case of females, okay, women, they go for the regular checkups also. But it is sometimes ignored due to the ignorance or due to the non-awareness. Okay, so women are exposed for the regular checkups are there. Okay, because of if any type of physiological or anatomical problem inside the female reproductive system, because problem in the attaining the pregnancy or may become the cause of the infertility. Okay? So cancer problem is very serious. That the patient will starting from the choice of treatment protocols. If the cancer is confirmed, go for the diagnosis and confirm what the treatment protocol is. Ongoing fertility planning, estimation of the gonadotoxicity or a potential multidisciplinary planning, choice of fertility preservation methods, guys. So this is also very helpful. So because of that, if we can get a onco-fertility planning, we should be doing that. In that case, because of if chemotherapy, it is simultaneously going on that. So it may be influence, okay, gonadotoxicity may work that. So it should be choice of the fertility preservation methods. We have the fertility preservation methods are there. Okay, egg bank or like that. Okay. Fertility preservations, embryo oocytes, cryopreservative, ovarian tissue freezing, okay, and GnRH analogs, gonadal shielding are there. Such techniques we have already there for the such type of patient guys. Cancer treatment, chemotherapy, radiotherapy often we using and follow up for the gynecologist, gynecologist, endocrinologist, psychologist, all that process. Specialty is concerned with the treatment. So in that case of cancer, we have to do the preventive maintenance. Risk factors, what type of risk factors are involved in the female reproductive system or infertility? Guys, that is the age, the major risk factor. Women's fertility gradually decline with the age, guys. Okay, not as well as the men, guys. Okay, men and women are different reproductive system, and as compared to men, females is very crucial time there for attaining the pregnancy, because especially in the mid of 30s, guys, and it is drops rapidly after age 37. Okay, because gradually decline the number of days. Okay, and fertility is older women is likely due to the lower number and quality of eggs, and can also be due to the health problems that are fertility. So as a human being, according to health data is showing that, okay, so after the 40 year, whether it's a man or women, they can get any type of health issues problem also. Up to the 40-year age that, okay, someone get the high BP, someone get the diabetes, someone get another communicable, non-communicable. Any type of issues may be arising in the body, guys. After the age of 40. Subsequently 40 to 50, 50 to 60, 70, 80 years. It may be number of complications are arising that. That is. So that's why in the young age we are very healthy. Our hormones level are very as per the requirement of the body, and our all the function body functional part is very active form are there, or they are free from a type of illness or disease. So that's why we have to go for earlier marriage, okay, rather than go for the late concern marriage are there. After that, mostly they create some type of infertility problems. Apart from this, tobacco use, smoking tobacco or marijuana by either partner may reduce the likelihood of pregnancy. Smoking also reduce the possibility effectiveness of fertility treatment. Miscarriages are more frequently in the women who smoke, guys. So during the pregnancy or before the pregnancy of any guys, yeah, because now the time in which we are, living, the society and the company, society and influences are there also. Okay, movements are taking the drinks, they are taking the smokings and some alcohol, so that as per the you know what type of society and what type of their culture are there. Okay, So late night parties are there. So in that cases, the more chances are there for the infertility guys because of their lifestyle is such a way. Okay. So they join such type of society companies or the society peoples are there. Okay, and they attending the parties are there. So we are cocktail parties. So like that lifestyle may hampering the uh, physical health of the women. Okay, so they should be aware about that. Sometimes due to the non-awareness or due to that part, they may later on in the age when they're going to planning for the baby or attending the baby, they have some complications. Apart from this, alcohol use for women, there is no safe level of alcohol use during the conception of pregnancy, guys. Alcohol use may contribute to the infertility. So, alcohol should be prohibited, guys, in the woman. Okay. So, because it may create some complication during the pregnancy attendance. Being overweight, it is also among the American women, guys, an inactive lifestyle and being overweight may increase the risk of infertility. So, when a patient is said to be healthy, guys, when a patient is said to be healthy, any participant give the answer? When a person is said to be
If the
healthy,
patient is
Sir,
physical, if the patient is physical, mental, and financially healthy, then it is called complete health, healthy, sir.
okay, physical,
actually, I'm
Mental
emotionally
mentally, and
and financially, sir, also. Financially.
financially. Okay. Any other definitions about when a patient is
A
said to be
person is
healthy?
called healthy when a particular person is socially, uh, economically, mentally, and physically, as well as psychologically healthy.
Okay. So how we can determine what is your good name? What is your
Sir,
good
my
name?
name is Yugang, Yugang Singh.
Okay, Jukang, you are physically healthy, okay? You are mentally healthy, okay? You are financially healthy and psychologically healthy. So how I can determine your health? Some parameters are there also, no? On which parameter I can evaluate that you are okay, these are okay with this. But how I can determine this parameter, physically parameters, which physical parameters, which are the mentally parameters, or financially or psychologically parameters, on which I came to one conclusion that you are a healthy person.
Sir, there are some physical tests according to which you can evaluate the person is either healthy or not.
Okay,
For physical tests, it's like you have to do some physical work. After that, what is your recovery time? If your recovery time is up to 1 minute, okay, there is a process in physical education in which your recovery time is set. After that, you again repeat the process, and then after your recovery time is monitored. If your recovery time is same, it means you are physically healthy, your lungs and your body is totally working in proper manner. Okay. After that, in mental health, you have to participate in various subjective or psychological tests in which you can understand the extent of your knowledge and the extent of your IQ. That's mental health. After that, psychological health. In a given condition, how would you respond to a stimulus or a condition that respond to your psychological health? And sir, sorry about that, but I can't explain financial health.
okay. In terms of simple layman language, how can we can execute that? Simple layman language.
If you have
Because
no complaint about any disease, sir, that means you are healthy. If patient have no complaint about any type of disease, about any type of pain, then it is called healthy, sir. According to physical health, sir.
okay,
Yes,
okay.
sir, I agree.
Okay, guys, simple terms, simple terms. Okay, so when you visit to a doctor, and what doctor diagnose, basic diagnose parameters, basic diagnose parameters.
BP, sir. Weight,
Yes.
height,
Weight,
Yes,
height,
weight,
blood
pressure,
pressure,
weight,
Yes,
height,
sir.
blood pressure, good.
Pulse rate,
Temperature,
And few blood
pulse
tests,
rate,
temperature.
pulse rate,
and
temperature, pulse rate.
Height is compared to weight, sir. Height is compared to weight
the
How
body
we can,
mass index.
okay, what is the standard weight?
according to BMI.
What is the standard weight, guys? How we can
If you
calculate
are 5.3 or 5.4, your weight should be in an average at least 50 to 52 kg. That's an
how,
BMI. That's a normal
okay,
BMI.
Yes,
no, how we can
yes.
calculate that? Okay, one person having the weight five, height is 5, okay, 5 is there, 5, okay, 5 is there, 5 foot
Sir,
5
there is a
inch.
formula. There is a formula according
Okay,
to which,
how we can determine the standard weight of that person?
sir,
How
there is a
much?
formula for finding BMI. It's the height of a person in centimeters upon the weight of the person in kgs.
I'm
According to
asking,
that,
okay, how much weight should be the the person having 5 foot 5 inch height? How we can determine the weight of that particular person? Standard weight. How we can? What will be the standard weight for that?
Thereby consulting from a standard body mass index chart.
Simple terms. Simple terms. We'll not go for more calculation on that. Okay? Simple formula is there.
it on weighing machine.
Yes.
Sir, by weighing it on weighing machine.
Nee, we have no weighing machine. Okay, online now. Okay, so tell me now.
Sir, in simple terms, body weight according to height, we can say that a person is uh, capable of handling himself. So that can be in simple language.
I am simple asking a person having 5 foot 5 inch height, how we can calculate the standard weight? What should be the standard weight around about it for that person? We have no weighing machine, okay? We have no any chart is available. Just simple formula is it. Anyone know about that?
No, sir.
Okay. So when we're talking overweight and underweight, guys, this is very important. We should be know that when we said to be underweight or when we said to be overweight. Okay. So what is your height and what is your weight? Um, I want to know about the 2-3 persons are there who tell me their height and
Sir,
weight.
mine is my name is Yugank, and mine weight is approx 65 kgs,
Okay,
and
height
the height is 5.4 feet.
5.4. Okay, very good. Second participant, anyone I need to know their weight and
Ranjan, sir.
height. Yes.
Yes, sir. Ranjan, sir. My height is 5.7
Okay, and weight
and weight is 70 kg, sir.
70 kg.
I think it is over there.
Gitanjali.
Little bit over.
Okay. Now we have the Gitanjali. How much weight, Gitanjali, do you have?
So 35 is my weight and 4.5 is height. 35
Okay.
kg.
Okay. So, guys, okay. Among the 3 participants, who is overweight and who is underweight?
Ranjan is
Always
overweight. And
Ranjan sir is overweight and
And who's underweight?
Gitanjali
Is
is
underweight.
underweight, sir.
Geet, you are
Gitanjali is
underweight.
underweight. Or how you know about that? कैसे आपको पता चला कि रंजन सर ओवरवेट हैं और गीतांजलि अंडरवेट है?
Height, sir.
हाँ, तो कैसे कैलकुलेट किया आपने?
Like, sir, ऐसे,
अच्छा,
like,
चार्ट
we get an
आइडिया है
idea.
चार्ट देखने का.
Like
No.
5'7" is like this, and
Okay, no. Let's think. Okay, how we can? Okay, we have some formula is there. Just you have to the height is okay. Height is 5 foot 4 inch. That is okay. So 5 multiply into 12. How much? 5 multiply into
60.
12.
60.
60.
60.
And okay, plus 60 plus 4. How much?
64.
64, sir.
64. Okay.
64.
So at the standard weight is round about 64 nearby. Okay. Okay. So 2, 3 or 4, 2, 3 maybe a variation will be there. Okay. So but round about 64 kg will be the standard weight. So I think our first participant is 65 kg. He
Yes,
has
sir.
a standard weight. Okay. बिल्कुल standard weight. इसने पूरी को अपना डाइट को कंट्रोल करके रखा हुआ है. फिजिकल एक्सरसाइज भी कर रहा है, जिम भी जा रहा है. आई थिंक सो दैट्स व्हाई इसका स्टैंडर्ड वेट गेन हुआ है. ठीक है, आई एम राइट?
Sir, I have left the physical
Yes.
हाँ,
physical
फिजिकल हेल्थ.
activities
ओके
for
ओके ओके
at
जी.
least
आपको आपको
6
उसकी
months.
आपकी उसको वेट से पता चल जाएगा कि उसका लाइफस्टाइल कैसा है. लिटिल बिट आइडिया अबाउट दैट. ओके. सो व्हेन वी गो टू द सेकंड पार्टिसिपेंट. ठीक है, तो उनका कितना होना चाहिए था? 5 into
5.8 है हमारा हाइट से.
तो 67
And
राउंड
weight
अबाउट
is
विल बी
70 kg.
हाँ 67 ना.
Yes.
तो
So
लिटिल
I
बिट
think
इट
I
little bit
2
because of
kg
that.
overweight, sir.
The reason behind that lifestyle sitting job is more.
Yes.
Okay, because
Yes, sir.
sitting job is more. That's the reason behind it. Otherwise, it is normal. It's not or high is there. It is not overweighting. We say that, but it is little bit high because of that. They are the job profile
According
and
to
according to
chart, sir.
lifestyle is there. Okay.
Yes.
Okay. After that, we go for the Gitanjali. Okay. So Gitanjali 4 into 12 plus 5. How much? How much, guys? Gitanjali should be. 8.
48.
Sir, 48 and 5 at least 53.
53,
But
sir.
she is 35.
53.
See.
Okay.
Too much underweight, sir.
Yes.
Yes.
53 na?
Yes, sir,
Yes,
53.
It is exactly 4 into 12. How much?
48.
48, sir. 48.
48 plus 5.
53.
Okay. So Gitanjali should have 53 kg weight. Okay. But she's the underweight. Okay. So we can guess that Gitanjali she is slim. Okay. I think she is slim, not okay. And she is long maybe. Okay. And maybe what is the age of Gitanjali? Gitanjali, what is the age?
22, sir.
22. Okay. 22 is there. So it is growing on age also is there. So according to that, Gitanjali, you are the underweight. Okay, now. Okay, so you have to check your hemoglobin and how much all the other blood parameters are there. So you should be attain 53 kg weight in this age and according to your height. Okay. So sometimes, guys, we are feeling okay, all the activities we're doing very well, okay, all that things, but still, according to WHO standard weight, height are there. Okay, sometimes we are underweight and sometimes we are overweight, guys. Okay, so due to our eating habits, guys. Okay, so eating habits are there. Sometimes anorexia, okay, underweight conditions are there. Okay, so low calories diet are there, restrictive diet are there. तो यहाँ से पता चलता है कि गीतांजलि का डाइट जो है, she is not taking the proper diet, healthy diet. She is not taking, maybe using more fast food and or other things are there. Okay, so diet should be recommended. Guys. Your diet will be make your weight and height. Okay, so proper diet is required. Okay. Okay, what type of diet is required? So you have to gain your standard weight. Okay. So apart from this, sometimes that may cause the infertility reason behind it. We oftenly ignore such type of parameters, guys. Okay, when exact time will become okay after the marriage, and we go for the planning the baby or go for the pregnancy time, then we remembering that, oh, this parameter is lacking there. Okay, this parameter may be the cause the some issues and problem. Okay, so you should be aware about that. Okay, which parameters may be was in future. Okay, so you can previously you can prepare for that or everything. You can do the preventive measurements, or you can eliminate the such type of causes also, which may become the infertility in women. Okay. So, but rather than some issue, some concern, hormone level concern is also going on there. Okay. So due to some hormone concern, due to thyroid also, thyroid stimulating hormone. In the thyroid stimulating hormone, hypothyroidism and hyperthyroidism may also concern if you are underweight or you are overweight. You go for the thyroid stimulating hormone test, T3, T4, TH guys. Because of that, it is concerned with your weight, under and overweight. If you are below to the very below, very severe below to the standard weight, a very higher overweight than the standard weight is there. So maybe some cases we can see the thyroid problems, thyroid dysfunctions problem. Excessive exercise, a lack of exercise contribute to obesity, guys. Okay, sometimes we are not doing enough or required the type of exercise. That time we are eating heavy calories type diet daily, or that may cause of obesity, which increase the risk of infertility. Okay. Less often ovulation problem may be associated with the frequency, strainers, intense exercise in women who are not overweight. So those women not overweight guys, but they are doing lot of physical exercise. Okay. Over physical exercise may cause also the infertility problem, or it will be interfere with the ovulation process. Okay, so you should be keep in mind, guys. Okay, those are some okay athletes or maybe some they are doing very vigorously exercise in case of women, guys. Okay, so they try to check up regularly. So apart from this, there's some little bit reason behind that IVF or why we go for the IVF or reduce the infertility. How can ART help for that? IVF work where the infertility treatment failure, the infertility treatment are failing because of that. Any reason behind that? If can be used by antibody or can be used by donate eggs or sperm, you can control over timing, increase your chance of having healthy baby, decrease your chance of miscarriage, increase your chance of conception. So ART will be later on discussed. We will discuss more about the infertility in women. Okay, so I hope so my screen is visible to you.
Yes, sir.
So as per the Indra IVF Fertility and IVF Center, female infertility concern we will be understand. What is female infertility? Or when we said to be a female is fertile. Okay, according to the definition of the World Health Organization, guys, infertility refers to an inability to conceive after 1 year of the regular sexual intercourse in the absence of any contraceptive. Okay, in that case, we can consider a female is infertile. Okay, then we go for the different type of investigations and checkups also. What is infertility? What is infertility, guys? Female infertility is a complex issue that affects many women worldwide. It refers to the inability of a woman to conceive and lead a pregnancy to term despite having regular unprotected sexual intercourse with a male partner for a year or more. Various factors including age, hormone imbalance, abnormal menstrual cycles are there, incapability of the producing eggs, anatomical issues are there, and lifestyle choices are there, can cause infertility in females. Let's check out what are the general causes, risk factors, and treatments of fertility problem in women. What are the causes are there? We will discuss now. Cause of infertility is one of the most cause we have discussed earlier. That reason we have female infertility. As women age, their fertility declines, and their chances of getting the pregnant decrease. Women are born with a certain number of eggs, and as the age, the quality and quantity of their eggs decrease. Women above age 40 compared to those of age 30 are at an increased risk of infertility due to their reduced ovarian reserve. Hormonal imbalances can also cause female infertility. Issues like polycystic ovarian syndrome because can lead to the irregular periods and prevent ovulations, leads to the infertility. Other hormonal imbalance like thyroid tissues and high prolactin levels can also affect the woman's infertility. Anatomical issue can also contribute to female infertility. Conditions like endometriosis, fibroids, polyps can also affect a woman's uterus and fallopian tubes, making it difficult for a egg to implant or a sperm to reach the egg. For example, blocked fallopian tubes can cause infertility as the egg and sperm can't meet. Abnormality in the structure of the uterus, such as septum or annulus, can also prevent the implantation case. Risk for female infertility. So there are several risk factors associated with the female infertility. As discussed above, age is significant factor. As a woman over the age of 35 or 40 years, they have a high risk of fertility. Women who smoke are also at an increased risk of infertility. As smoking can damage the reproductive system and reduce the number and quality of eggs. Other lifestyle choices such as excessive alcohol consumptions and drug use can also affect fertility. Medical conditions such as PCOS, endometriosis, thyroid problems can also increase the risk of female infertility. In addition, women with a history of sexual transmitted infections or pelvic inflammatory disease are also at an increased risk of infertility, as these conditions can cause scarring and damage to the reproductive system. Test for female infertility. So we know about the risk, we know the causes are there. So what type of tests should be recommended in this part? If a woman struggles to conceive, her doctors maybe recommend various tests to determine the cause of infertility. Blood test can be used to check hormone levels and determine if hormonal imbalances could affect fertility. And ultrasound can also check the ovaries and uterus for structure abnormality or conditions like endometriosis or fibroids. Okay, apart from this, sterols, salpingogram, HSG can also be used to check for blocked fallopian tubes. This involves injecting a dye into the uterus and fallopian tubes and taking an X-ray to see if the dye flows through the tubes properly or not. So whether the fallopian tubes are blocked or not blocked, we can check. Treatment for the female infertility. What type of treatment we have? The treatment of the female infertility depends on the cause of the infertility. In some cases, lifestyle changes can also improve the fertility. For example, quitting smoking and reducing the alcohol consumption can improve the woman's chances for conceiving. Losing weight and can also help improve the fertility in the woman because in case of hormone imbalance, medication can be prescribed to the regular hormones and improve fertility. For example, clomiphene citrate induce ovulation in the woman with PCOS to other hormone imbalance. Gonadotropins are another type of medication that can be used for to stimulate ovulations. Apart from this, we go for the surgical intervention, guys. May be necessary to correct anatomical issues that are caused in fertility. For example, surgery can be used to correct blockage or damage in the fallopian tubes or uterus, which may prevent fertilization or implantation of fertilization eggs. In some cases, surgery may also be used to remove fibroids or cysts affecting the fertility. Another option for women struggling with infertility is assisted reproductive technology, ARTs, which include various procedures that can help increase the chance of pregnancy. Assisted reproductive technology encompasses various procedures such as in vitro fertilizations, where eggs are extracted from the woman's ovaries, fertilized with the sperm, and implanted into the uterus. Other ART methods including intracytoplasmic sperm injections, that is the ICSI, which involves a single sperm being injected directly into the egg, and gamete intrafallopian transfer, GIFT, GIFT, okay, GIFT. So, what the meaning of GIFT is there? Gamete intrafallopian transference, where eggs and sperms are deposited into the fallopian tubes. These procedures offer hope to couples facing fertility issues and enables them to achieve their dreams of having a child. If it is important to note that while surgical intervention and ART procedures can be effective in helping women with infertility, they are not without risk and may not be successful for all. Additionally, these procedures can be expensive and insurance coverage for infertility treatment may vary. Therefore, it is important for a woman to carefully consider their options and work with doctors to find their best treatment plan for their situation. Female infertility can be a challenging and emotional issue for many women and couples. While there are many potential reasons for infertility in women, including age, hormone imbalance, anatomical issues are there are also many effective treatments available. Women who are struggling with infertility should work with their healthcare providers to determine the underlying cause and explore the appropriate treatment options, which may include lifestyle changes, medication, surgery, or AIT, assisted reproductive technologies. Okay, so this is a little bit idea about the infertility guys and what type of medications are in. Let's see the symptoms guys. Symptoms of female infertility. So how we can determine a female infertility guys? What type of symptoms we can see guys?
Menstruation cycle is not.
Okay. So what are the different signs and symptoms of female infertility? Okay. So infertility is a condition that limits one chance of becoming pregnant and giving birth to a child. This is often identified in couples after a year of attempting to conceive. Though it may be a diagnosed earlier depending on factors contributing to the infertility. For couples, 1/3 of the infertility causes are attributed to the male issues, 1/3 to female issues, and other 1/3 to the combination of both factors, unidentified causes. In case of female infertility, often known as a female factor, and infertility is when the female partner has infertility issues. Let's look some of the common signs and symptoms. What type of sign or symptoms we can see? Discuss. Some female infertility symptoms are frequently connected to other underlying illness, guys. 10 to 15% of the untreated chlamydia cases. These are the pelvic inflammatory disease. Okay? And this lead to the blockage of the fallopian tube, which cause infertility. Apart from this, several other conditions affect fertility as well. Sign of infertility in women may vary depending on the different individuals. So if you have trouble conceiving, consult a doctor immediately. Some of the common symptoms of infertility in a woman. So first reason we have the irregular periods. So this is very important because of that, due to the lack of knowledge and the lack of concerns are there. Irregular periods account for the 30% to 40% of all fertility cases, guys. So if in terms of we are studying the infertility cases, 30 to 40% cases are concerned with the irregular period. That's why pregnancy is not attained in the women. Okay, the menstrual cycle is 28 days, but as long as those cycles are irregular, if fluctuations of few days can be regarded as normal. However, a woman may experience irregular periods if her cycle fluctuates so greatly that she is unable to predict when her period will arrive. Several factors cause irregular periods, such as the stress. Okay, so guys, stress is also very important factor is there nowadays, or stress is the mother cause of every disease. Okay. So stress have to be eliminated. Stress have to be released by meditations, by yoga, and other methods are there. Okay, techniques are there. So stress should be not in the mind, because stress may be due to the many reasons. Some are struggling in their career, some are struggling in their relationship, some are struggling in the financial conditions. Okay, whatever reason. What is the most precious thing in this world, guys? Which is the most दुनिया की सबसे कीमती चीज क्या है इस दुनिया में?
Health, sir.
Okay. So health is the most
Precious.
precious thing in this
Precious,
world.
sir.
Okay. Because of that, without health, you can't do anything or you can't enjoy anything, guys. You have the $1 million, okay. You have luxurious lifestyle. Everything do you have. But if your health is not appropriate, your health is not concern that is there. So what the significance of that? You will not feel happy from inside. Okay. So try to understand life cycle, guys. Okay. Okay. What do you have? What do you want to achieve? And how do you want to achieve? And what you have to sacrifice? And what do you have? And how you can utilize your present resources, guys. Okay. So don't go for the materialistic happiness, guys, because of that it may be create lot of stress, guys. Okay. So we will discuss in depthly why people get stressed and what is the root causes of stress are there. Okay. So there are some psychological factors are also involved in the stress. Okay. So that's why or why in the relationship such type of conflicts and stress are oftenly produced. Apart from this, we have the hormonal imbalance, guys. Certain medical conditions, medications, irregular periods can also be a sign of PCOS, and polycystic ovarian syndrome, which can also be caused infertility. Second reasons, we have no periods at all. That may be the cause of infertility. It is not uncommon for women to miss a period, guys. This might happen due to the stress, workout, or other lifestyle factors. But continuous missing periods might be a matter of concern. You must seek medical attention and get your fertility checkup, guys. If some nothing happening in menstrual cycles, or maybe some dysmenorrhea or sometimes issues are there. You have to go for the gynecologist and go for the regular checkup, guys, because reproductive system is very important for rebirth. Okay. Third reason, we have the painful for heavy period. Periodic cramps and pain are very common. However, heavy or painful periods can be a red alert for you. This might be a sign of endometriosis. Okay? So you should be keep in consideration, guys, if the women having very high pain during the menstrual cycles. Okay, so it is a red alert. Okay, they go for the clinical checkups for the gynecologist. Okay, so because it may be the sign of endometriosis, and it is a huge symptoms of infertility. Other symptoms of endometriosis are that is the pain during the sex. Okay, these are the symptoms of endometriosis problem. Guys. Okay, because apart from the clinical diagnostics and test laboratories are there, what type of symptoms, okay, you can feel inside the body or okay, there is the pain during the sex is there, fatigue oftenly, back pain, chronic pelvic inflammation, nausea, irregular bowel movement, irregular periods and spottiness. So if some symptoms like that inside the body, woman feel okay, and she's getting too pain during the menstrual cycles and periodic cramps are happening. So should we go for the medical checkup? Okay, concern with the gynecologist. Okay, it may be the cause of endometriosis. The earlier diagnosis can be prevent or treat the endometriosis, but when the stages are coming later on, it will be difficult to treat. So that's why you go for the regular checkups. Apart from this, with the symptoms of the hormone, guys, fluctuation. Okay, hormone changes can be non-specific. You might not notice them or know the exact cause. Also, it is one of the common cause of infertility. And however, a doctor can test for some hormone issues. The hormone fluctuation can affect the body in many ways, including Unexplained weight gain, guys. Okay. So when unexplained weight gain is going on, you have to go for the regular checkup of the weight, guys. Okay. So if it is gradually increasing the weight, or cold feet and hands, okay, sometimes are there, cold feet, hands, facial hair on the female, sometimes it is happening, guys. Some facial hair are coming on the female due to the hormonal changes. Thinning hair on the crown, nipple discharge, severe acne are there, reduced sex drive are there. So these all the symptoms are concerned with the hormone fluctuation, guys. Okay, if any symptoms like that you are seeing inside your body, okay, and you have to consult with a gynecologist because go for the clinical diagnostic. So some maybe the issue concerned with the hormone fluctuation or maybe lead to the infertility in future. Okay, so let me discuss one by one. Pain during the sex, guys. Some women experience pain during the sex their entire lives. They are convinced that this is common. It might be related to the hormonal issues, endometriosis, and other underlying conditions which could be related to the female infertility. Okay. In the natural process, it may be a little bit pain are there, but it's severe pain is there, what it be the cause of endometriosis. Second is vaginal soreness or irritability, guys. Soreness and irritability with the white discharge, okay, could mean vaginal infections. Okay. So if you are feeling the white discharge, okay, from the vagina, or it if left untreated, an infection maybe chlamydia is there, gonorrhea is there, mycoplasma can eventually lead to the infertility. So if such type of white discharge you are seeing, you have to go for the clinical diagnosis and consult with the gynecologist, guys. Okay, because of that, it may cause of some infection, bacterial infection inside the reproductive system, guys. Or people oftenly feel shy and don't discuss to anyone, okay, sometimes, but they have to discuss and go for the clinical diagnosis. Okay, don't be ignored. Dark or pale menstrual blood, guys. If your period blood is paler than before, it might be a sign of concern. Menstrual blood is usually bright and red initially, which might turn pale red after a few days. Darker blood during the initial days of menstruation can be a sign of endometriosis. If you experience such a symptoms, it is important to see a doctor. Okay, so you should be keep under the observation. Obesity, if you are overweight, there might be a chance of overweight will affect your reproductive health. Ideal weight and good health may not always be a sign of fertility in women, but it is preferably in achieving pregnancy. So regular check the weight. Unable to conceive, the reason behind it. Unable to conceive, the primary sign of female fertility are not getting pregnant or being unable to conceive even after trying for a certain period. You must see a doctor after trying for at least 1 year. Okay. So what are the other risk factors concerned with the female infertility? Uh, these are the risk factors female infertility in women are as age of the person. Women of age 40 years have more or less the chance to get in a pregnancy. So you should be planned according to that. Okay. Because when the age growing, is gradually increasing, may cause of infertility. Smoking, tobacco, marijuana, stress, poor diet is asked for. Uterus fibroids, cyst may come sometimes, ovarian cyst, okay, polycystic ovarian syndrome, unhealthy lifestyle, history of sexually transmitted infection, drinking alcohols. These all are the causes of infertility. When to see doctor? You must see a doctor immediately when you experience any sign of infertility and have been unsuccessfully at conceiving for more than 1 year. They might be offered you several treatment for infertility, including we have the infertility drugs. Okay, fertility drugs are given to stimulate the hormone responsible for the maturing and releasing of the eggs, and could help those with ovarian disorders. However, fertility drugs have side effects such as ovarian hyperstimulation syndrome, or increased chance of developing ovarian tumors. So, according to consultation with the expert gynecologist, you have to, okay. So because of that, every pharmaceutical product has some type of side effects and adverse drug reactions also. Second, we have the solution IUI, guys. During IUI, million of healthy sperm are injected into the uterus during the ovulations. And third, we have surgical procedure. Okay, the doctor corrects any abnormality or blockage in the fallopian tube, then uterus with surgical procedures. However, these treatments are rarely used these days because of successful rate of the IVF cuts. And fourth, we have solution IVF cuts. That's we are discussing and we are studying about the IVF. IVF is the most effective system reproductive treatment method. In this procedure, the ovary is stimulated to develop eggs. After a few days, the eggs are harvested and fertilized in the lab. After the egg are fertilized, the embryo is transferred to the uterus. About 15 to 20% of the couples trying to conceive will have fertility problems. Female factors in fertility are typically responsible for 40% of the times. So if you think you could be having difficulty becoming pregnant in the future, you are not alone. Using advanced technologies, okay. So IVF offers expertise in the fertility treatment, okay, helping the couple start their family. Okay, so all type of treatments are covered. Okay. So what are the causes behind that? Let me discuss. Female causes are there. These all causes we have discussed already. The ovulation problem, polycystic ovarian syndrome, because endometriosis is there, issue is concerned. Uterine fibroids, age factor, genetic factors are there. We have risk and complications. What type of risk and complications concern that? Okay. The reason of female infertility can be linked to a chance in the hormone production as well as the lifestyle changes that can impact our normal body function. This comes in the way of normal conception. It impacts fertility in broadly the following ways. An ovulation due to the which fertilized can't be take place naturally. That is irregular menses like causing ovulation, delay or its occurrence ahead in time. Hormonal imbalance causing sex hormone in which women such as estrogen and progesterone produce in either more or less quantities than required. This and growth of tissues, polyps, or tumors in the reproductive system can hinder the process of conception or pregnancy. Problems such as blockage in fallopian tubes doesn't allow develop eggs to travel from the ovaries for fertilization, structure problem in the uterus, and act as a barrier for sperm to reach the egg. So what type of treatment we have for that? And test we have to. Okay. So what type of treatments for a couple hoping to have children? Infertility is a serious dilemma. A couple is a technically deemed infertile if despite regular and unprotected sex and they can't conceive for a full year. If you and your spouse are trying to get pregnant but aren't having any luck, you might start to question whether you should consider fertility test. Infertility is typically defined as a period of 12 consecutive months without conceiving. This isn't always the case. According to the several studies, women start having children with help in the second or third year. Female infertility is a rather common condition. At least 10% of women have infertility of some form. As a woman matures, her odds of becoming fertile is. Okay, when should a woman take a fertility test? To naturally become pregnant, it is preferably to wait a few years, depending on the woman's age. There is a right moment to seek a treatment or take a fertility test. Women between 35 to 40 may seek therapy after at least 6 months of trying. Women over 40 years are encouraged to see the doctors right away. How is a woman fertility tested? We have some lab diagnostics are there, tests are there. Although the consultation with your family doctors is the first step in determining the female fertility status, your medical backgrounds and way of life will be carefully addressed during this visit. Birth control use, menstrual cycles, pregnancy history, current and former sexual practices, use of drugs, surgical history, other health concerns, lifestyle, and work living conditions will all be examined. Based on these, doctor will be suggest the appropriate women's fertility test. Okay, so we have different type of fertility tests are there. Okay, pap smear test. Guys, pap smear test I have told already about it a bit. Okay, when we go for the cervical cancer, guys, this test looks for abnormal cells surrounding the cervix, and the test can detect sexually transmitted disease and cervical abnormality, including cervical cancer. Any of these factors might make it difficult to become pregnant. So, if any type of factors or weaker cancer is there, we go for the pap smear test. Or it comes under liquid biopsy. We have already available. Urine test, your physician could advise to do the luteinizing hormone, okay, LH urine test at home. So kits are available. This hormone is highly concentrated right before ovulation. Blood test, depending on your medical history and the potential diagnosis guide, your doctors will choose what lab test you need. Some laboratory procedure are tested for the thyroid. Thyroid test is there, prolactin test is there, ovarian reserve test, and progesterone test. You must ovulate or have the release of eggs once a month to get pregnant. You might require tests to look for ovulation problems. You may independently check your body temperature every morning. A little increase in the body temperature is seen immediately after ovulation. You may figure out your ovulation pattern by checking it every morning for 7 months. Test for reproductive organs, guys. So we have different type of tests are available. We check the reproductive organs. Okay, your fallopian tubes, ovaries, uterus might all function before you may become pregnant. Various women's fertility tests that can use to determine the health of these organs may be recommended by your doctors. Some of these are like HSG, okay, vestido salpingogram. They tested. It is known as a tubogram. Okay. Consists of many X-ray of your uterus and fallopian tubes. To take X-ray, your doctor put liquid dye through the vagina. HSG can be used to determine whether you have any uterine issues or blocked fallopian tubes. The test takes place immediately following your period. Second, we have transvaginal ultrasound. Okay. In the transvaginal ultrasound, the pelvic organs are examined with the ultrasound band that the doctor inserts in the vagina, and they can view the ovaries and uterus using sound waves to detect any issues. Next, we have the laparoscopy test. Your doctor insert instrument, including a camera, after making a few tiny incisions in your abdomen. Your whole pelvis can be examined during this procedure, and any issue might be resolved, including endometriosis, which affects your pelvic organs. Apart from the hysteroscopy is there. In this test, a flexible thin instrument known as the hysteroscope with a camera is placed into the vagina and the cervix. The medical professional inserts the device into the uterus to observe the organs interiorly. Saline sonohysterogram test check the polyps, fibroids, and other structural irregularities in the uterine line. During a transvaginal ultrasound, saline water is injected into the uterus to fill up and give the medical professionals a clear picture of the uterine cavity. Apart from this, we have some laboratory test. Okay, that is the follicle stimulating hormone. Okay. So the follicle stimulating hormone test involves in the clomiphene straight challenging testing. Okay, you take a tablet containing clomiphene citrate between the 5th and the 9th day of your menstrual cycle. Follicle stimulating hormone is measured before and after the medication is taken. on the day 3 and the day 10, respectively. High follicle stimulating hormone levels, just low pregnancy odds. So, such type of investigations also available with the follicle stimulating hormone. Second, we have the anti-malaria hormone here, guys. Okay, anti-malaria hormone is additionally your physician can advise a blood test to look for anti-malaria hormone. The amount of anti-malaria hormone can provide insight into the ovarian functions. Okay, and extremely low levels may indicate a inadequate ovarian reserve. The ovarian reserve, if sometimes symptoms are there, we go for the anti-malaria hormone is there. And apart from this, we have the postcoital test. Postcoital test is an extra checkup after having intercourse. Your doctor looks at the cervical mucus. According to certain search, it might not be so helpful. So mostly we're doing follicle stimulating hormone, anti-bleeding hormone. Endometrial biopsy, we have. Your doctor may also suggest an endometrial biopsy. Okay, they extract a tissue sample from your lining of your uterus during this surgery. And however, there is a growing proof that endometrial biopsy can't be used to diagnose or treat infertility. Who should think about having a female fertility test? Women with following problems, in addition to those who have been unable uh, to conceive for years, over 6 months if they are over 35, might think about fertility test for women. So we go for the diagnosed problem with the uterus, ovaries, fallopian tubes, reproductive system, multiple miscarriages are happening at the, they go for the test. If your periods are uncomfortable or heavy, okay, endometriosis is a disease that develops as a result of painful or lengthy periods. Heavy erectic with a break of more than 35 days. Okay, non-existent menstruations. If you have a hormonal imbalance in symptoms, including skin problems, facial hair growth, diminished sex drives, okay, then go for the laboratory test. Partner with a history of a diagnosis of female infertility, history of endometriosis, pelvic discomfort, pelvic inflammatory disease. Okay. What are the treatment of female infertility? So what a treatment we have? There are several female infertility treatments available if your doctor has determined the reason and diagnosed female infertility. The form of female infertility treatment is determined by the cause of infertility. For instance, surgical procedures may be used. Correct structural abnormalities. Fertility drugs may be used to treat other problems such as thyroid diseases are there, problem with the ovulations. Numerous people will require treatment such as IVF, ICSI, which involves drugs to stimulate ovulations, fertilizing eggs externally with egg and sperm from the partner's or a donor, followed by the transfer of the embryo into the uterus, and artificial insemination, which involves injecting washed sperm into the uterus following ovulation. What steps should be taken to overcome female infertility, guys? Women who intend to become a mother must be a healthy weight, guys. Okay. Intense exercise lasting longer than 5 hours per week, however, may have an impact on the ovulation, according to some research. To maintain optimal reproductive health, it is essential to avoid substances like alcohol and tobacco, since they have many harmful effects on the body and reduce your chances of getting pregnant. Since stress is the risk of the infertility, guys, avoiding stressful activities is essential in addition to any other intervention. So these are some type of need for investigations. What type of solutions we have? The solution we have with our new IVF specialists. Okay, so various companies are doing like that. Indra IVF is armed with the doctors who provide the end-to-end solutions to female infertility. They are providing the consultation, diagnosis, treatment, and up to the conception. Okay, so our doctors specialize in handling the case of required stereoscopy, sometimes laparoscopy. We are the best in the country for providing assisted reproductive technologies. Okay, so the procedure begins by the stimulating the female ovaries to produce multiple eggs with the help of hormone injection, guys. About 15 eggs are collected after this process during ovum pickup, guys. So in coming sessions, we go for the ovum pickup, all the techniques we will discuss on that. Okay. A sperm sample is taken from the partner and the washed sperm is used to fertilize it. Donor eggs may also be used in case of the female patients. Reserve is proposed. depleted liver. We have in vitro fertilization technique. Okay, we have already very discussed. Collected eggs and washed sperm are placed in a patty dish and monitored for a fertilization. Once the resultant embryo reaches the blastocyst stage, they are transferred into the uterus. Second, we have the intrauterine insemination, IUI, guys. When natural ovulation takes place, sperm are directly placed inside the uterus to increase the probability of fertilization. In case the female is experiencing anovulations of the other complication related to the process, it may be introduced using medication. Third, we have the ICSI, guys. Okay. Intracytoplasmic sperm injection, single robust sperm is selected and injected into the egg of the fertilization. So this is the entire information about female infertility. So what type of queries oftenly patient have in their minds that we discuss. Okay, so how to increase the woman infertility? हम लोग कैसे woman infertility को increase कर सकते हैं? So a little bit idea about regular health checkups can be help of flag and underlying health condition that can potentially impact on the fertility in women. Additionally, living a healthy lifestyle by managing stress, eating and balanced diet, regular physical activity can also boost fertility. Second, what are the some food items that increase the fertility in female? So concerned with the diet, it is also very important. Okay, so what type of food intake? Okay, iron-rich food such as beans, lentils, spinach, whole grains. They are lower the risk of infertility from the ovulatory dysfunction. Food with the vitamin C such as lemons and oranges help with the iron absorptions. Consumption with monosaturated fats like avocado, olive oils, and other healthy fats. Cutting down on trans fat, incorporating more vegetable protein from lentils, chickpeas, mung beans, green peas instead of meat-based protein cuts. Multivitamins, switching to high-fat diet, dairy, okay, food with folic acid such as dark leafy vegetables. Fortified grains, supplements may also be suggested to women trying to conceive to meet the 400 microgram per day goal. So dietary chart should be recommended for okay for fertility in the to increase the fertility in female guys. Okay, guys. So this is little bit the idea about female infertility, their root causes, their identification, different tools and techniques, and lab diagnostics. And apart from this, what type of solution we have presently? Okay, let me diagnose part is there. How we can diagnose, guys? Okay, this is the infertility detection troubles will drop down into bubbles infertility comprehensive panel, guys. This is available in the market. I think screen is visible to everyone, guys. Screen is visible.
No, sir. No,
No,
sir.
sir, not yet.
Screen is not visible.
No, sir.
Visible, sir, but nothing is.
Folder
Okay.
is visible.
Folder for that folder I'm showing them na? In the lateral alpha clef folder. It is visible.
Yes, yes, sir.
Okay. So now go in the clinical practices. What type of investigations are available, guys? Okay. So we have the infertility comprehensive test panel. Okay. So in infertility comprehensive test panels, what type of test we have performed? That is the follicle stimulating hormone, LH, prolactin, stimulating hormone, estradiols, thyroid stimulating. Yes. Testosterone total we are determining. So let's see. Okay. So infertility is a disease of reproductive system defined by the failure for achieve clinical pregnancy after 12 months or more regular unprotected sexual intercourse. Ovulatory dysfunction account for the 20 to 40% cases of infertility in female guys. A common cause of ovulatory dysfunctions, that is the hypothyroidism, guys. Okay, low level of TH. Okay, hyperprolactinemia, hypogonadotropic hypogonadism, hypergonadotropic hypogonadism, polycystic ovarian syndrome. So these are some causes behind the ovulatory dysfunction. Infertility comprehensive panel, doctor can be prescribed for the infertility comprehensive panel, guys, if any patient concerned with infertility. Okay, this infertility comprehensive panel containing the follicle stimulating hormone, LH, prolactin, testosterone, TH, and estradiol, and glucagon. Okay, so what is the significance of these type of hormones? Thyroid stimulating hormone, that is that to rule out hypothyroidism. It is maybe lead to the secondary hyperprolactinemia. Second, prolactin. Hyperprolactinemia is one of the most common entities associated with the chronic anovulation, guys. LHFH to rule out the hypogonadism due to the hypothalamic or pituitary dysfunction, to rule out the hypergonadotropic state. Example, premature ovarian failure. Increase LHFH ratio is 75 picos. Okay, तो अगर रिपोर्ट में LHFH ratio is 75 picos, guys. Estrogen. Estrogen is a product of granulosa cells and reflects follicular activity, guys. Testosterone. PCOS is the most common cause of the androgen excess, and serum testosterone is the most important test to evaluate the androgen excess. Anti-mullerian hormone. Anti-mullerian hormone reflects the size of primordial follicle pool and is a useful marker for the ovarian reserve. It also helps to assess ovarian function in patient with PCOD, because polycystic. So this type of panels are available in the market, guys, for the diagnostic. So in single panel, we can check number of parameters, guys. Okay, let's see the clinical report. I hope so my screen is visible to everyone, guys. I am expecting. Okay, it is visible.
Yes, sir. Visible, sir.
Okay. So this report is concerned with the PCOD. Okay, we have discussed about the PCOD, polycystic ovarian disease. Comprehensive panel is also available. Okay. So in this evaluation report, hexokinase method is there. Evaluation for the insulin resistance, we go for the glucose plasma fasting, insulin serum, beta cell function, insulin sensitivity, HOMA IR index, cholesterol total, triglyceride, HDL cholesterol, okay, and LDL, VLDL cholesterol, okay, FH, LH, LH-FH ratio, prolactin serum, testosterone, DHEA sulfate test. So these are some parameters are there. Okay, guys, let's see the parameters. Tell me whether this report is normal or abnormal is there. And what is your conclusion about this report, guys?
Abnormal report, sir. Few parameters are abnormal.
What is the conclusion of came from this report, guys?
The patient is suffering from PCOD problem, sir.
How you came to know about that? कैसे आपको पता चला कि ये रिपोर्ट पीसीओडी की रिपोर्ट है? कौन कौन से पैरामीटर आप लोगों ने कंसीडर किया और कैसे कैलकुलेट किया?
HOMA IR index is also increased, sir.
Yes. Okay. Yeah,
I'm
let's
not able to scroll, sir. Yes, sir. I'm not able to scroll. Testosterone, DHEA sulfate, all these tests are parameters is abnormal, sir.
So why? What is the correlation between PCOD and these parameters? Any idea about that?
The PCOD arrests the oocytes, and this is because the LH and FSH level is abnormal, sir.
Okay. So FH2 is there. Normal is 1.40 to 80. LH2 is there. 1.50 to 9.30. The ratio is 1, less than 2. So these are the normal or abnormal?
Normal, sir. FSH LH is normal. Prolactin testosterone is abnormal, sir.
So even though they are normal, but still they are very close to the ratio.
So how we can correlate with the PCOD2? These parameters, those are abnormal. Thyroid stimulating hormone, anti-malignant hormone. We adding two parameters in. So let me discuss about that. So guys, we have anti-malignant hormone 22 guys, and normal range 0.73 to 16 nanogram per ml. So when we determine the PCOD problem guys, okay, so the ratio of LH and FH greater than 2.50 indicate the presence of PCOS guys. Okay? Polycystic ovarian syndrome. So one parameter we consider that. Second parameter, if anti-malignant hormone concentration is greater than 3.5 nanogram per ml guys. In this report, how much we have? Anti-malignant hormone parameter?
So it's 22.
So it is greater than 3.5. So it means we can predict the PCOS. One signal we're getting. Thyroid stimulating hormone level are said to be circadian variations reaching peak level between 2 to 4 a.m. and at a minimum between 6 to 10 p.m. And the variation is often ordered to 50%. Hence, time of the day has influence on the measurement of the serum TH concentration. So, thyroid stimulating hormone value less than 0.03 need to be clinically correlated to the due to the presence of a rare TH variant in the some individuals. Okay, so guys, the timing of sampling, the concentration of a particular hormone, okay, and that are variants according to we have to determine guys. So one parameter we are considering that. Polycystic ovarian syndrome is a complex syndrome, and each of the clinical phenotype is associated with the different patterns of steroid hormones. It is likely that simultaneously measure of the multiple androgen, steroid androgen profiling with the high specific and sensitive method LCMS. Okay, be more sensitive to detecting PCOS related to androgen excess and for the predicting metabolic risk guys. Women with non-classical congenital adrenal hyperplasia guys. Due to the 21 hydroxylase deficiency and the women with PCOS have similar clinical presentations with hyperandrogenism, oligomenorrhea, polycystic ovarian. The screening tools of distinguishing the NCCH from PCOS is the basal 70 OHP guys and level and the ACTH stimulating test and tests conducted in the plasma and serum. So further evaluation, we go for the more parameters. So this is the interpretation of lipid profile, guys. Okay. So according to age, optimum, above optimum, borderline, high, and very high. The total cholesterol level in milligram per deciliter, that is the less than 12. Okay, optimal less than 170. Borderline 171 to 199, and it's greater than 200. That is the high problem. Triglyceride, okay, we have less than 150, borderline 150 to 199, and if will be 200 to 499, then the high is there. Very high is the 5 greater than 500. LDL, same, we have less 5, 12 here. 110 is there, and borderline 111, 129, and greater than 130 is the high risk. And it is greater than 12. Okay, we have borderline 160 to 189, and 190 is more very high parameter. Okay. And this is also very important. Interpretation. Menstrual pause phases are there according to their follicular mid-cycle peak luteal phases there. So reference range for follicle stimulating hormone, guys. Reference range for luteinizing hormone. Okay, and the condition non-pregnant, pregnant, post-menopausal, and reference range for prolactin, guys. Okay, so according to the condition of the patient, okay, we have put the some parameters or the clinical parameters are there. So according to that, we can determine that. Okay, so for the non-pregnant women's parameter are different are there. Okay, for pregnant women, parameter are different. Post-menopausal parameter different. So according to the condition, okay, so we can determine the FH, LH, and prolactin level in the woman. Polycystic ovarian syndrome affects 5 to 10% of women of reproductive age, making it is the most common endocrine disorder of women in the this age group. It is characterized by the amenorrhea, hirsutism, and infertility. It is caused by a complex interaction of abundance in gonadotropins, androgens, estrogens, insulin resistance, and hyperinsulinemia contribute a significant risk of pathophysiology. Although PCOS is associated with the hyperandrogenism and ability earlier in life, it is a harbinger of a lifelong condition that can lead to the serious sequelae such as endometrial, ovarian cancer, diverticulitis, coronary artery disease. It is crucial to diagnose because earlier in the course, not only to recognize but also to delay or rest its metabolic sequelae. So this is a little bit idea about what type of report is there concerned with PCOD. So before when you go for the IVF and all that, some reports, patient will be carry some reports file also. Okay, so they visit number of doctors. They already taken a lot of medications, consultation for different doctors when they come in your clinic for IVF. Okay, so how you can evaluate the different reports, okay, concerned with the root cause of infertility in the woman. So you should have the knowledge about it. Okay, guys, these all are concerned with the female reproductive system, various causes of infertility in women, guys. Okay, so anyone have any question or inquiry want to ask? Shall we close the sessions? Okay, guys, I hope so it will give the more elaborative information and understanding about infertility in the women, guys. For each and every concern with the cause, concern with infertility, we have discussed in deeply. Okay, now is it going to 9:30 is there? I think you have their own schedule. Okay, for that. So we have to close the session now. Okay, so we will see you on Monday. Okay, and okay, bye bye to all of you guys.
Thank you.
Okay, sir. Thank you, sir.
Okay, welcome to you.
Thank you, sir.